Good morning, everyone. Let's just give another minute or so, but we are right on time, but we want to be mindful of time, so we will start here in just a minute or so. Good morning, everyone, and welcome to day 2 of the Texas Fall Prevention Awareness Week. This is a wonderful week where we get to raise awareness about falls and what we can do to recognize that they exist and address them with practical solutions. So we're very excited for today's event. Remember, tomorrow is the first day of fall, which is usually National Fall Prevention Awareness Day, but we're celebrating this entire week. But we also know that it's not just one week. We need to celebrate and recognize the issues surrounding falls every day, all year round. So thank you to all of our sponsors for Texas Falls Prevention Awareness Week. We have our sponsorship from the Texas A&M Center for Population Health and Aging, the Texas Active for Life Coalition, the Texas Association of Area Agencies on Aging, the Texas Healthy at Home, and Texas Health and Human Services. So with that said, thank you so much. Really appreciate everybody being here. On the next slide, I just wanted to go ahead and say, outstanding. There's a governor's proclamation. This Texas Falls Prevention Awareness Week was officially recognized by Governor Abbott. On our webinar yesterday, I read the proclamation, but I'm not going to do that today. It is available on our website. Please feel free to visit fallspreventiontexas.org. On the research tab or resources tab, you'll be able to see the full proclamation. But we really appreciate that. It's always wonderful to have the support of the governor about something that is so important to all of us as we do this. So with that said, I'd like to turn it over to Ashley for some updates about our Falls Prevention Awareness Survey.
Sure. So thank you attendees for being here. I just had a question from Robert, and I was going to point this out. This isn't a webinar mode, so all attendees are automatically in mute. So please type any questions you have into this box. We'll have some time for questions at the end as well. Or you can raise your hand, and I think we're able to let you speak if you need to speak, but I will be monitoring that throughout the time as well. So Robert, no worries. I believe you're on mute, even though your mute button is not pressed, along with everyone else. So on to the next bit of business. So each year after Falls Prevention Week or Falls Prevention Day, the National Council on Aging sends out a survey to the states to try to gather some information on the different events that took place in each state during the month of September around Falls Prevention Awareness Day. Well, this year, the Texas Active for Life Coalition decided to do a pre-survey across the whole state to see if we could gather information beforehand, during the week, and then we'd have a really good report going back to NCOA about what was going on around the state. So far, I actually checked today, we had one more response. So we have 24 responses on this survey right now. And sorry, just go back one, Lauren. I don't know if we have 23 responses on the survey, and it's from different partners across the state that the Texas Falls Prevention Group has sent it out to. We have AAAs that are doing activities across the state, Meals on Wheels, academic partners, community centers, senior living, and corporate partners that have all reported they're doing some falls prevention awareness events across the state, and we're really excited about that. Different things that they're doing, mainly, most of all, people are doing webinars, kind of like what we're doing, or they're distributing falls prevention educational information, either in person at health fairs or via social media. Some people are also kicking off some new EBPs, evidence-based programs, this week. And we're really glad to have this information. And we encourage you, if you can go to the next slide, Lauren, I think it's on here. We encourage you, if you haven't already taken this survey, to please take it. At the end of the webinar, the link will be up. You can also find it on our new website that we have this year, which is fallspreventiontexas.org, which again, will be up at the end of this webinar. But if you're participating or doing any types of events, we'd really like that feedback. We wanted to highlight a couple people that told us times of their events. And that is the Brookdale Senior Center in Tarrant County. They gave us a couple of events that they're having. So if anybody wants to jump on those, they're here on 9/22 and they're on Zoom. So you can get a hold of those or get a hold of us and we can get you those. The Brazos Valley Area Agency on Aging. They started a Malware Balance this month and are continuing it this month in honor of Falls Prevention Week. And then the Area Agency on Aging of East Texas, they're doing Matter Balance classes, and they also received a local proclamation. So those are some events that we have going on. Again, we just want to collect information and other events that are going on across the state. So please take the survey and send to your other partners that you may have. Get as many responses as we can so we can report back to NCOA what a great job Texas did this week during Falls Prevention Week. I think that's, you can go to the next one, Lauren. I think it was the end of that. So
absolutely. Well, it's my pleasure to introduce the main event and our primary speaker for today, Chelsea Couch. And Chelsea is the statewide Texercise program coordinator and has worked with the state of Texas since 2009. Her work involves developing local and statewide health initiatives that encourage individuals and communities to engage in healthy lifestyles. She is responsible for overseeing the various components of the program development, its public awareness related to public health and Texercise. Chelsea is a certified health education specialist, and prior to working on Texercise, she attended Texas State University in San Marcos, where she obtained a dual degree in nutrition and food science and health and fitness management with a minor in business administration. Chelsea serves on a variety of different work groups, too many to name, but I'll just throw out a few: the Texas Cardiovascular Disease and Stroke Council, the Active for Life Coalition and the Steering Committee, and also does so much beyond all of this. If I took the time, I'd have to keep going, but that would cut into her time. So let me just turn it over to Chelsea and say thank you so much for taking the time to talk to us today.
Thank you, everyone, and thank you, Matthew, for that introduction. Today, I'm going to be sharing about Texercise, which is what I primarily focus on at the state. Next slide, please. So I am with the Texas Health and Human Services. We are the largest state agency and focus on providing health and human services that covers a lot of different areas, from eligibility and determination, including like SNAP, licensing and regulating different state hospitals and state supported living centers, as well as ombudsman services and aging programs. And aging programs is primarily what our office really focuses on. Next slide. So I'm in the Office of Aging Services Coordination, and our office is really working to ensure that older Texans have opportunities to age and live well. And that is on social connection, health and fitness, nutrition, financial, legal, all of those kind of pillars of aging well, as well as working to cross-coordinate across divisions within the agency to ensure that we are working together and connecting and making sure that we have those aging program sources to help support older Texans. But like I said, the main thing that I focus on is Texercise. So next slide, please. So with Texercise, and the reason we do what we are doing is because there is a changing face of Texas. As we all know, that the aging population is the fastest growing population. And so that means that we're going to have a lot more older Texans here in our state, that we need to make sure we have resources and services and programs to help support them. Next slide. So one reason we look at Texercise is with the high cost of inactivity. We know that being inactive really has some adverse health outcomes and can lead to those outcomes. So 80% of American adults do not meet the national physical activity recommendations, and being inactive can lead to or increase your risk of a lot of different chronic conditions, as you can see here on this slide. Next slide, please. But the good news is that many of these are preventable. So preventable illness may make up 80% of the burden of illness, but 90% of and 90% of healthcare costs, but that is preventable. So by taking action steps, by being engaged in regular physical activity, eating a healthy diet, we can help reduce the risk factors for these chronic conditions. Next slide. And there's a lot of different benefits to exercise, not only decreasing your risk for chronic conditions, increasing energy levels, reducing costs of medical care, an improved sense of well-being, but also by engaging in activities that strengthen your muscles, that improve your balance, you also reduce your risk for having a fall and experience a fall. Next slide. So now that we've kind of talked about that, I'm going to go more into Texercise. So get on your mark. Next slide. So Texercise is a statewide health promotion initiative that's operated by Health and Human Services. We aim to educate and involve individuals and communities in physical activities and proper nutrition. And so we really do aim to not only provide the why it's important, but here's how. Next slide. And it really is for everyone. Anyone can benefit from engaging in regular physical activity and healthy eating. However, we do target adults 45 and older, so that way we can hopefully prevent some aging services from being needed or even delaying the onset of when those are needed. We provide educational, motivational, and recognition resources to help motivate and keep older Texans committed to engaging in healthy aging behaviors. Next slide. We currently offer two free programs to organizations and communities. They include Texercise Classic and Select. We'll go into a little bit more detail in the next slide. Next slide, please. Yeah. So Texercise Classic is was the first program we ever offered. It's a 12-week program that brings people together for one day each week for 12 weeks. And they engage in some type of physical activity. So that can be line dancing, Zumba, water aerobics, whatever that activity is that's going to spark joy in the participants, because we want it to be fun and engaging, because you're more likely to stick with a habit if it's something that you look forward to. It can be led by anyone, and we provide a classic coordinator kit that provides hosts everything necessary to host the program. Next slide. From Classic, we did keep hearing buzzwords of evidence-based and knew that we needed to develop an evidence-based program, and we entered into a contract with Texas A&M Center for Population Health and Aging, and they conducted 2 different research studies and really helped develop an Texercise Select, which is a free 10-week evidence-based program that leads participants through interactive educational discussions as well as physical activity. The twice-weekly meetings are for 90-minute sessions. Each session is. The first session focuses on a fitness topic. So one may be the importance of strength training. And so they'll really dive into that strength training topic, how they can engage in strength building activities, setting an overall goal and breaking it into smaller action steps, as well as problem solving any kind of barriers to their action plan that they face and finding solutions that may work for them for the next time. And the second session is focused on a nutrition topic. So portions, what are the appropriate portions to be eating, and how can they figure out what those look like and properly plate their food. And so to be able to do Texercise Select, a facilitator must take an online training and pass with a score of at least 80 to become my certified facilitator, and then we send them their facilitator kit. So again, these are 2 free programs that Texercise offers to communities and organizations to implement in their local area to have that be an opportunity for older Texans in their area to engage in these behaviors. We do provide free reinforcement items such as pedometers, resistance bands, t-shirts throughout those programs. Next slide. And this slide is just showing kind of what our kits look like. This is what our classic kit looks like. So the Select Facilitator Kit is a little bit different in that it has a more in-depth manual that really outlines every activity that needs to be done in each session. So it is more in-depth and more structured. One thing to note with Select is that the exercises in our handbook are what are the exercises that can be done in Select. So that's the only activity that you can really lead within Select, because that's what was studied and found to be effective. So next slide. And before I get in, I'm going to lead y'all through a Texercise demonstration, so get y'all up and moving. But before I do that, I do want to share that we have some Texercise SNAP-Ed projects. In 2019, we were awarded SNAP-Ed funds to work on 4 different projects, one being enhancing and expanding Texercise Classic and Select. And then next slide. Our next project was our Texercise Nourish, and this is going to be a free 12-week nutrition program that really highlights the nutrition education and dives into depth with how to make these healthy eating behavior changes. And this is going to have a lot of those components found in Classic and Select. That way it's very easy to implement, but also it gives some flexibility in modifying for the hosts to provide their own little bit of flavor to the program as well, to make sure that we are meeting the needs of the participants. Next slide. Another one is Texercise Prevents Malnutrition in Older Texans. This is an awareness campaign that is targeting professionals serving older Texans to really raise awareness of malnutrition in older adults, but also the signs and symptoms, as well as community-based resources that can help combat it. So we have a variety of different materials available that you can use to share information with your members and participants. And we just recently launched this campaign this week, last week, around there. So we're really excited to have this launched and rolled out. Next slide. And our last project with SNAP-Ed is Texercise Connect. It is a free web-based intergenerational activity workbook that will bring youth and older adults together to engage in healthy behaviors. So really focusing on that social connection and engagement, but also incorporating them engaging and learning about healthy behaviors. So physical activity, healthy eating, brain health activities, as well as being creative. So next slide. And I know I'm running through this, but I want to give us ample time for questions and answers and demonstration. So I want to get y'all up and moving. So get ready to move. Next slide. So we're going to do a quick Texercise demonstration. I encourage you all to stay in your chair. I will say I try to always have a chair that doesn't have wheels. Unfortunately, I am at home in my room, and so my chair does have wheels, but I'm going to be safe and make sure that I am staying seated during all these exercises that we're going to be going through. You are more than welcome to do them standing as well, but I will be demonstrating them in a chair. Just make sure you're holding onto a chair or using a wall for support. So next slide. We're going to start by doing a warm-up and endurance. So I'm going to scoot back. Hopefully, I'm going to project my voice, so hopefully you can still hear me. So we're going to start by taking some deep breaths. So take a deep breath in, hold it, and then release. And again, hold it and release. And one more. Take a deep breath in, hold it, and release. Now we're going to do what's called Reach for the Sky, and this is a fun activity name that was developed by CPHA researchers. So we're just going to bring our arms up and reach really tall, really elongate our back, hold it, feel that stretch, and then come back down We're going to do 3 of these. So reach one more time. Hold and down. And the last one, reach for the sky and down. Next, we're going to move on to our neck stretches. We're going to do 2 different neck stretches, one going from side to side and then one ear to shoulder. So we're going to start with the side to side. We're going to do 3 on each side. So first, look over your right shoulder to the right. Hold it. And next, the left. And you want to make sure you make sure your shoulders aren't coming up to your ears. So really make sure they're staying down. Back to center, to the right. And again to the left. And then the last time to each side. Once to the right. And once to the left. Come back to center. And we're going to do our ear to ear, but ear to shoulder kind of move. We're going to take our right ear to our right shoulder, but you don't want to bring your right shoulder up to your ear. You want to make sure it's staying down so you really get that nice stretch. If you want to add a little bit more of a stretch, you can gently place your right hand on your neck and help pull, but you don't want to pull too hard. If it aches or has a pain, you kind of back off of it so that way you feel comfortable. Just a nice little stretch. So come back to center and take it to the left. And keep repeating for 2 more times on each side. All right, last ones. All right, and I always do a little shake out before I move on to next ones. I just like the way it feels. So next we're going to do our shoulder rolls. We're going to do 3 forward and 3 backwards. We'll start with our forward. So just roll your shoulders. And if you want to do more than 3, you can. I just put 3 so we don't run out of time and don't have time for questions. Next, roll backwards. All right. Next, we're going to do arm stretches. And this is just gently, please, moving your right arm and leaning over. So kind of a side and arm stretch. Again, to the left. And to the right. And again, if you feel any kind of pain, just bring back off of the stretch a little bit. You still want to stretch, but you shouldn't be in any kind of pain. And one last one on the left. And then back to center. So I'm not sure how to show you all this one, but it's an ankle roll. And you're literally just going to take your ankles and you're just going to roll them. And you're going to do 5 on going each direction. 3, 4, 5. Whatever direction you started with, do the opposite. 1, 2, 3, 4, 5. And then next, you're going to keep your feet on the ground with your heels staying on the ground. And we're just going to do toe taps for 15 seconds. And go. And good. Shake out those legs a little bit. We're going to move into our endurance. And this is just a brief kind of example of what is done in Texercise Select for the warm-up and endurance. We didn't go full in-depth into it, but they are longer. So these walking in place and marching in place are a lot longer in the Select done. But I'm going to say again in my chair. If you want to make it easier, scoot further back in your chair. If you want to make it a little harder, you can sit more on the edge of your chair and just walk in place. So this is just a very light walking in place. It's just to get your legs, your breath, your heart, kind of ready for the more intense. We're gonna march just for a little bit. Usually, if y'all were unmuted, I'd be asking how you're doing in a virtual setting so I could get some response. So I'm hoping all of you are feeling good and ready. We're going to go ahead and start marching more vigorously. So you're going to want to pull your knees closer up and higher up, but also in a faster pace, because you really want to get that heart pumping, that blood going, your lungs working really good. And again, we're going to do this for a minute, so I am watching the time. If at any point you're feeling dizzy or lightheaded or too out of breath, back down on your speed or how high you're bringing your knees to a more comfortable pace for yourself. We're going to go for just a little bit longer and come back down. We're still going to march, but we're going to go at a lower pace and not bring our knees up as high, because we want to bring our heart rate and our breath back down, but gradually. We don't want to just stop cold turkey. Okay, we should be feeling pretty good. You should feel a little bit warm, but not too warm and not too out of breath. And we're gonna I'm gonna give my legs a shake before we go to our next slide. Next slide, please. Also, it's a good idea to take a drink of water. Always have some water by you for some hydration during any kind of workout. Next, I'm doing one kind of activity for each pillar of exercise. So we just did our warm up and endurance. Next, we're going to be doing strength, and we'll be doing arm raises. If you have some light weights that you want to use and you feel comfortable using them, you can, but also you can just create a fist with your hands, and really clench it so you can feel the tension in your muscles. And we're just going to bring our arms out up to shoulder height. You don't want to go above shoulder height. You don't want to hyperextend, so just to shoulder height. If that hurts you, bring them up as far as feels comfortable for you. We're going to do 15 repetitions. You can sit or stand. Again, I'm going to demonstrate it sitting and encourage you to do so as well, because we want to prevent any falls from happening, and this is one way we can do that. So have your arms by your side, I'm mixing up my syllables here. Clench your fist and slowly raise your arms to shoulder height, and then hold and bring down, but you want to do a controlled bring down to really work that muscle. And 2, bring up to shoulder, hold, and gradually bring down. Go up 3, shoulder height and hold, gradually bring down. 4, hold, and down. 5, up and down. 6, up and down. 7, hold and down. 8, up and down. 9, up and down. 10, up and hold, down. We only have 5 more. 11, up and down. 12, up, down. 13, and down. Last 2, 14, and 15. Great job, everyone. And just shake it out, loosen your arms. Next slide, please. So now we're going to go into balance. As many of you know, doing these strength and balance exercises kind of really work well together, because you're building strength within your muscles but also improving your balance is a great way and one of the best ways to prevent a fall from occurring. And so making sure that you're doing exercises to improve balance and strength is a cornerstone of making sure we're preventing any falls from occurring. I'm going to scoot back kind of far so y'all can see. I am just going to be sitting, but you'll still get a workout in. And we're going to be rocking on our heels and toes. But when we come up on our toes, we're going to hold and then come back on our heels and hold. So when we're up on our toes, our heels are going to be off of the ground. And when we rock back on our heels, our toes will be off the ground. And we're going to do 15 of these. I'm going to try to situate myself to where you can see my feet. But if you can't, the picture kind of does a good description. So we're going to start by rocking up on our toes for 1 and holding. You should feel it in your calf and slowly rock back on your heels and hold your toes. 2, go up on your toes, rock back on your heels. 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, last 2, 14, and 15. Again, this is just a very brief example of what would be done in a select since we are on a time allotment right now. We'll go to our next slide. Again, take a drink of water if you need to. Our next slide is our flexibility or stretching. So making sure that after we work out our muscles that we're also doing things in order to stretch them and kind of cool us down as well. We're going to do our shoulder stretches. We'll do like 3 of them for each side and hold for about 10 seconds. And you just take I'm going to start with my right arm and just gently bring it behind my neck and touch my other opposite shoulder. If this is too hard for you, only come where it feels comfortable. You do not want to be in pain. You do want to feel a slight stretch, but not in pain. Switch arms. And switch arms again. And go to your left arm. Last time on each side. And last one. All right, and shake it out. I hope y'all all feel energized and good after that little brief demonstration. Again, this is a small taste of some of the exercises in our handbook that are utilized in Select. There are a lot of different ones. We encourage you to go online and order your free handbook to get even more of the exercises as well as some nutrition information. Go to the next slide, please. Where we're going to get ready to move on to our questions and our part of the presentation. Next slide. But before we do that, I do want to leave you with a little bit of a Texercise challenge. If you're with an organization or community that really supports older Texans and does activities, we encourage you to host a Texercise Classic or Select program in your community. You can contact Texercise at that email for program materials, so a host kit, as well as use our online ordering system to order reinforcement items. Our website is www.texercise.com, and that will be on the last slide, so don't feel like you have to write it down right now. Also, to create awareness of your Texercise program and start recruiting participants, and then share any success stories that you may have. And I also encourage you, if you're not interested or aren't able to host a program, order a handbook, order them for your loved ones that are older that you want to see engaging in these healthy aging behaviors. And next slide. And I will open it up for questions.
I put some questions in the chat there, Chelsea. I don't know if you can see those.
Yeah. Okay. Let me.
Or I can ask them out loud.
So currently the typical kind of organizations that really host Texercise programs are your community and senior centers. The area agencies on aging have done Texercise. We've also had like faith-based organizations, long-term care facilities. I've even had like people before kind of find us at a health fair, and they're just passionate about helping older Texans engage in behaviors, and they've started a program within their neighborhood for their older residents. So it can be a variety of different organizations. Typically, you're going to find with Select, it's those area agencies on aging, the community and senior centers that take the online training to really kind of provide that program. So older adults can definitely access Texercise resources via our website or order a free copy of our handbook. We also have exercise videos on our website. It's on the Get Texercise page of the website. And there's 4 different videos that have a geriatric physical therapist from Fort Bend, Texas, leading a group of older Texans through some of the exercises from our handbook. So older adults can do that by themselves at home if they want. And we actually did just have our DVDs, those videos replicated. So we do have some hard copy DVDs that we can provide. If they want to take part within a classic or select program, they kind of do need to have an organization that's hosting it and take part through them, whether that's at their local community and senior center or through a AAA. Those kind of programs are kind of a formal kind of program setting and not done by one person.
Okay, so resources is what people have access to if they're going solo. Otherwise, they would need to find an organization that is hosting it. Is that correct?
Yes, and we also, like, many times when people reach out like wanting to know where a program is, I can definitely help connect them to programming that's currently going on with Texercise or with facilitators or coordinators within the area to find out when their next kind of program will be held. So I am able to help connect people as well.
Okay, and they just go to your website to get in touch with you?
Yes, or that email will come to our Texercise mailbox, and myself and a colleague do check that mailbox, so it will come to me either way. Yeah.
And last question from me, I believe you said it in here, but it was just confirming. So to organizations, this program is free of charge? Is that correct?
Yes, okay. Everything with Texercise is free. There's no cost to host organizations and no cost to the end participant.
Okay.
Chelsea, this is Matthew. I really thank you so much for telling us all this information, and I've learned new things, so I'm excited to learn that there are these new SNAP-Ed funds and these new projects coming. So can you tell us, obviously, Texercise Classic, Texercise Select, they're already a hallmark, they're available all throughout the great state of Texas. But what about the Nourish program being developed, this new malnutrition campaign and the intergenerational Connect initiative? How do you see all of this synergizing, and how do you see them all promoting Texercise in various elements?
I think we look at it from a public health, aging health kind of perspective, in that health is not just physical activity and nutrition. Those are big points, and that's always going to be cornerstones to Texercise. But having a program that is fully on a nutrition education, it's going to have bits of physical activity because, they complement each other, they go together. But it is going to be that 90% of it is really focused on that nutrition and diving deep into those kind of topics. It's going to be similarly kind of promoted and have a similar outreach as Classic and Select. We're going to tap into our existing coordinator and facilitator network, but also outreaching to other organizations that may need some nutrition education, whether or not they have ones that they maybe don't have the funds to kind of develop on their own. Here's a free resource that they can use and they can implement. Nourish will also have some reinforcement items with it. So like a portion plate, a reusable grocery bag, a little reusable snack pouch. So different reinforcement items to reinforce the messages that's being taught in the program. With the malnutrition campaign, this is an issue that was brought to our attention years ago. And it's just, with anything, when you're developing it, it takes time to develop the resources. And this is just something we feel passionately about. It is a prevalent issue facing older Texans, and it can, it can present differently. The signs and symptoms, the risk factors for older adults with facing or at risk of malnutrition are different than what we kind of conceptualize. I think a lot of people, when they hear malnutrition, they have a certain image in their head, and that's not always how malnutrition looks. When you are looking at anyone could be malnourished depending on what essential nutrients they are or are not getting. So really targeting those professionals working with and serving older adults that, hey, this is an issue that you need to be aware of. Here are signs and symptoms and risk factors that you can kind of keep an eye out for. But not only that, here are community-based resources that you can refer and connect your participants, your members, your clients to help combat it. It's a really important issue, but we also need to know that there are resources out there that can help. And there's nothing wrong with needing a service if it means that it's going to help improve your health. And with Texercise Connect, Matthew, I know you and I have had, and you've came and presented to work groups that I'm a part of on the importance of social connection. I think COVID-19 has really shown all of us that this is a really huge health topic, and it impacts our overall health so much. And we felt like, intergenerational activities and services and programming can do so much for not only the older adult, but for the youth. And so this really kind of brings those two generations together to form a connection, be socially engaged with one another, but also being engaged in healthy activities. It's important for youth and it's important for older adults to learn about and engage in these behaviors. So we just see this all being part of making sure that we're making the healthiest population we can and really focusing on older adults.
Simply outstanding.
That answered your question.
Yeah, all of those touch points, but that's the beauty of it. And also, the problem is that it's multifaceted, it's all intertwined. You can usually focus on one aspect, but that's not focusing on the whole person. It's not person-centered, it's not organization-centered. So here, by expanding this, I just commend you all on thinking it through to include so many of these different topics that are so very interrelated.
Yes, exactly. Whole people are not just one thing. We need to make sure that we're looking at the whole person and the whole outlook of what health really means and wellness really means.
I have one more question, and I think it dovetails onto what Ashley had just asked. You told us about the different organizations who've adopted Texercise, whether it be Classic or Select. And you've talked about, the various resources that are available so that people can learn more. What practical recommendations would you give to any organization to better know Texercise and determine whether or not it's right for them and ways they can adopt it and integrate it into their workflow?
One, have organizational buy-in from all aspects of the organization. So it can't just be a top-down or an up, like bottom-up kind of approach. It really needs to be everyone is engaged and feels like this is an important part. But also looking at capacity. I know that we are all crazy busy in this world, and COVID-19 has shifted a lot of focus and needs for operations, but also make sure that you're looking at volunteers. volunteers are such a great resource to tap into, especially when you have a small organization, or maybe even if you have a big organization, if everyone who's part of that organization is so already overworked that maybe offering a Texercise program isn't feasible for you, look at your volunteers. There are some really great, passionate, committed people that could help lead and take that part of it and really kind of run with it. They are a really great resource. But also, if maybe it's not hosting a program right now, even if it's getting a bulk order of handbooks that you can then provide to your participants, just one little thing. It doesn't have to be all in at one time, even if it's just passing out a handbook. I feel like sharing resources is one thing we can all do.
Couldn't agree more. That is outstanding. Well, as our time winds down, I look to any of the other audience members to pose a question. Otherwise, I would like to just make sure that we thank Chelsea. Thank you so much for your time, your expertise, for sharing this great information with us. I do believe, absolutely. And thank you for supporting Texas Falls Prevention Awareness Week. But I know with Texercise, you're doing it year round, which is what we all strive for anyway.
Yes.
Yes, and Lauren, I don't know if there was one last slide on there that had the Texas Falls Prevention website. If you could share that back up with everyone. This is a new website we have this year, and we hope to continue it, where we put all of our Falls Prevention Week resources. There will be the recordings of these, so people can go back and watch later. Any surveys we have, or any PowerPoints we have, we can post there. There's also the link to the survey here. Like I said, we'd appreciate anyone that's doing any sort of event over the next few weeks during Fall Prevention Week or month. So please take that survey and share with your colleagues and partners who you think might be doing events as well. So there's the direct link to the survey. It's a short Qualtrics survey, and also it's also on our website as well under the resources.
Thank you for that. Absolutely. And so please tell us what you're doing around the state. We want to be able to capture what the state is doing and report it back so that we have a strong representation. I want to thank again, Chelsea, thank you so much for talking to us. Also, thank you so much to all of our sponsors as seen on this slide below. Unite Us, Texas Health and Human Services, Texas Healthy at Home, T4A, and of course, the Center for Population Health and Aging. More fun to happen next tomorrow, same time, 11 o'clock. There will be yet another presentation in our virtual Texas Falls Prevention Awareness Week. Please join us again. Thank you so very much. And with that, I will say we have concluded. Thank you. Thank you.